Hello, everybody. My name is Keith Farnes, and I am a certified asthma educator. When I first started studying for that exam, one of the things I learned is that you are supposed to incorporate some of the things the patient is already using, things that you might think of as alternative treatments, into their asthma plans. So, when I first started researching the material for this course, I was assuming I was going to talk about many things that most of us would think of as a bunch of hogwash, also known as BS. However, that turned out not necessarily to be the case. While I am not a believer in everything in this course, some of the material in here does have value, and you might want to incorporate it into your treatment plans for your patients. I have included some of the more dubious items in here just because you never know, you might just run into some of them. The topic of this course is Alternative Approaches to Asthma. It is approved by the AARC for 1 CRCE credit hour. And of course, we do not have any financial sponsors to tell you about. Your learning objectives for this lesson are to discuss alternative medications to standard regimens and to discuss asthma remedies that complement conventional therapies. This means things we are going to discuss today are not meant to replace the medications that we use, but they might be used in addition to them. In Western medicine, we diagnose asthma by combining several things to get to the answer. We look at spirometry results, chest x-rays, CT scans, skin tests looking for allergies, patient history, and we must also rule out other potential diagnoses. I'm sure you are very familiar with those. Well, here are some of the alternative ways people have found to diagnose asthma. Using a two-pronged thermometer, you can measure the difference in temperature between the sides of the spine. Some practitioners use iridology, where lesions, coloring, and blemishes of the eye to make diagnosis. Certain areas of the iris are believed to be related to certain parts of the body, and sickness in an organ can be seen in the color of the iris. Pulse rate has been used to determine if a patient has a particular condition. And some practitioners in Southeast Asia might look at a patient's tongue to make the diagnosis. The reference I was looking at actually mentioned that the forthcoming ways to diagnose asthma are of dubious value. However, I thought we already were there. Apparently not. Samples from the hair from your head are examined under a microscope to make the diagnosis. Vega testing is where the electrical conductivity of your body is measured by a machine to make the diagnosis, and Vega testing can be used to check for allergies. Segmental electrograph testing is a diagnostic method which measures segments of your body that are stimulated in turn. So this is sort of like Vega testing, except it's just different segments of your body instead of your whole body. Lastly, there is palm reading, where asthma can be detected by looking at the palms of your patient's hands. If they can't diagnose your asthma, maybe they can at least tell your future. Before I get into alternative treatments, I think it's wise to review accepted standard treatments. All respiratory therapists should have a working knowledge of these treatments. If you feel you need to know this better, you should consider taking our course on classification and management of asthma. All asthmatics have at least intermittent asthma and should carry a SABA in their pocket. SABA, SABA meaning short-acting beta agonist. This could be something like albuterol HFA. These are known as rescue medications. If they have more frequent episodes, then they would be classified as having persistent asthma, either mild, moderate, or severe, and need controller medications in addition to rescue meds. They need to control factors affecting their asthma, avoiding triggers and allergens, and possibly immunotherapy. Medications that are used are bronchodilators, inhaled corticosteroids, including combination drugs such as Symbicort, immunomodulators like anti-IgE, leukotriene receptor antagonists, also known as leukotriene modifiers, and for exacerbations, oral IV steroids, IV aminophylline, magnesium sulfate, and Heliox. These are all accepted as the standard of care. Now that we've reviewed the traditional medications, let's move on to some alternative medications. Here's a list of medications we will cover in the forthcoming slides. Most of these have been studied as corticosteroid-sparing agents, meaning they might reduce the level of steroids needed. Azothiaprin has been investigated as an oral corticosteroid-sparing agent. Currently, there's a clear lack of evidence to support the use of this in the treatment of chronic asthma as a steroid-sparing agent. Large, long-term studies with predefined steroid-reducing protocols are required before recommendations for clinical practice can be made. Cyclosporine is an immunosuppressive agent that you might be familiar with from the use in organ transplantation to prevent rejection, but it does have benefits in the treatment of a number of inflammatory disorders. It has therefore been identified as a potentially useful agent in the treatment of chronic severe asthma, both in terms of possible efficacy and as a steroid-sparing agent. Now, I did read about a double-blind, placebo-controlled, randomized, parallel group trial on the effect of cyclosporine on pulmonary function, asthma severity, and tapering of prednisone. In the end, cyclosporine seemed to be slightly more efficient than placebo in reducing the requirement for systemic corticosteroids, even though the steroid reduction was accompanied by slight impairment of some pulmonary function. However, there was no significant difference in the final dose reduction between the treatment groups. Those data and the known toxicity of the drug suggest a limited place for cyclosporine treatment in steroid-dependent bronchial asthma. Epizone has anti-inflammatory properties, therefore it may have a beneficial effect in the treatment of asthma and act as a corticosteroid-sparing agent. You might remember the name from our course on hemoglobin abnormalities, as it can cause both methemoglobinemia and sulfhemoglobinemia. If you haven't taken that course, I recommend it. It's one of my favorites. Dapsone is currently the agent of choice in the treatment of all forms of leprosy, unless the organism exhibits dapsone resistance. Dapsone can be used prophylaxis for PCP pneumonia, either as a single agent or in combination with trimethoprim. When used in combination with pyrimethamine, dapsone is effective for prevention of toxoplasmosis in patients with AIDS. If you are unfamiliar with these, please check out our course on HIV/AIDS update. As of 2002, no randomized controlled trials had been published, so there is no reliable evidence to show whether dapsone is beneficial or otherwise in the management of steroid-dependent asthmatic patients, and that is the most current stuff I could locate. Gold, yes, the element. Gold compounds are immunosuppressive agents and have benefits in the treatment of a number of inflammatory disorders, and was studied around 2001 for use as an oral corticosteroid-sparing agent in stable asthma. It was determined that gold may have a small impact, but the adverse effects and monitoring needed didn't outweigh the benefits. Gold at that time wasn't recommended. I'm sure if I offered some of my patients a shot of this, I would be a very popular RT, regardless if it worked for their asthma. The next drug you may never have heard of until it was made famous by former President Trump as a possible cure for COVID, the anti-malarial drug Hydroxychloroquine, although it is a second-line drug for rheumatoid arthritis. By the way, studies showed it didn't have any effect on COVID. It did, however, cause more cardiac side effects. Unfortunately, like many other drugs, it didn't work. Hydroxychloroquine is an inhibitor of phospholipase A2. It could therefore be expected to reduce the production of leukotrienes and prostaglandins in the airways. As you probably know, those can cause airway inflammation. Unfortunately, currently there is no evidence to support its use as a steroid-sparing agent. Inhaled furysimide, also known as Lasix. This has been shown effective as an additional therapy for severe exacerbations that are refractory, that's a fancy word for your therapy didn't work, to conventional medical therapy. Mode of action is still under investigation with no side effects and no diuretic effects reported. Inhaled heparin has been shown to prevent exercise-induced asthma without influencing histamine-induced bronchoconstriction. Heparin doesn't seem to have direct effect on smooth muscle. This non-anticoagulant action is more likely to be related to a modulation of mediator release than to a direct effect on the smooth muscle. Mixed results were had on airway resistance when using methylcholine challenge testing. No adverse effects were noted in the studies I read. Ivig, this is intravenous immunoglobulin. So this is a product made up of antibodies that can be given IV. As you probably know, antibodies are proteins that your body makes to help you fight infections. Think about this. Which patients might benefit from this therapy? Steroid-dependent allergic asthma and atopic dermatitis. Administration on a regular basis appears to reduce the need for systemic corticosteroids. It can reduce symptoms and reduce hospitalization costs. Ketamine. So ketamine works as a bronchodilator, and its addition to the standard treatment regimen of severe asthma has been shown to improve outcomes and alleviate the need for mechanical ventilation. However, more large prospective clinical trials are warranted. Methotrexate has significant oral corticosteroid sparing effect while maintaining an asthma control and consistent spirometry results. Methotrexate appears to be an effective oral corticosteroid sparing agent in a significant proportion of patients with severe asthma. This was more pronounced in patients with higher steroid doses, and long-term use may be needed for maximal benefit. The specific asthma phenotype endotype that responds needs further studies. Contraindications for methotrexate were kidney or liver diseases and pregnancy. Contraception was mandatory for women and men treated with methotrexate, as well as their partners. So they were serious about not getting pregnant. Myosin hasn't been shown to significantly improve asthma control or reduce steroid dependency. As you can see, more work needs to be done in finding alternatives to steroids or steroid-sparing agents. Now that we have talked about acceptable pharmacological treatments and some investigational ones, let's get into the more truly alternative types of treatments. Asthmatics generally have two patterns of breathing. They can either have a caved-in chest, their shoulders will be hunched over with very limited chest movement, almost as if they're afraid to breathe, or they're kind of barrel-chested, which is actually caused by the habitual overuse of the accessory muscles, causing them to hypertrophy, and also by air trapping. Regardless, neither of these use the diaphragm effectively. The patient needs to be taught how to correct their unnatural mode of breathing. Here are some breathing exercises for your patients. Pursed lip breathing, which you probably teach your patients all the time. They inhale through their nose and exhale through pursed lips very slowly, which extends expiration and also causes some physiologic PEEP, holding their airways open. The more air they can get out of their lungs, the more air they can breathe in on the next breath. Swimming is excellent for both general exercise and breathing exercising. Floating in the water is a very good way to learn how to relax. Singing is very good, and also using a wind or brass instrument should be encouraged. For most people, the diaphragm does about 65% of the work of breathing, but for asthmatics, it's only about 30%. That's why it's so important to teach diaphragmatic breathing. Diaphragmatic breathing exercises are something I'm sure you've all learned in RT school, but as a reminder, the patient can place their hands on their abdomen, or if lying down, maybe a book. Then they concentrate on their breathing, trying to force air down to their diaphragm. As that happens, their fingers should spread apart as their chest expands, or the book will rise. Either way, that gives them a visual clue that they're doing it correctly. They should be encouraged to breathe out and slow, and don't be tempted to overbreathe. Do not hyperventilate. Just allow themselves to relax and not aggravate their asthma. Exercising is good for all patients, even asthmatics. They need to be encouraged to exercise daily. Many of them will think they can't exercise because of their breathing, but their breathing will actually get better the more they exercise. Stress and anxiety can trigger an asthma attack. They need to learn to manage stress and to relax. When you come home from work, you're tired, you're exhausted, you sit down in a chair, and you just let out a big long sigh as your whole body relaxes. Again, the more air you can exhale, the more air you can inhale on the next breath. Encourage your patients to practice their breathing exercises 5 to 10 minutes every day. Like all exercises, it's consistency that counts. Here are some exercises you can suggest for your patients. Like I mentioned, swimming is excellent for breathing exercises if done correctly. You should breathe out underwater for about 4 or 5 strokes and then only breathe in for 1 stroke. This is how it should be done, and it would give you very long expiratory times, perhaps an IDE ratio of maybe 1 to 4 or even 1 to 5. Walking, running, cycling, as long as you maintain a good breathing pattern, these are all excellent. As far as walking, should be a nice slow pace, maybe 10 to 15 minutes every day. And it's also a very good relaxing exercise. Doesn't really matter if you're a good singer or not. What matters is that they are singing. They could try singing by themselves in the shower, maybe singing along to the radio while driving their car. Again, it doesn't really matter where or when. It just matters that they are doing it consistently. Laughing can be a very good lung exercise, and it is certainly a lot easier than doing push-ups. Perhaps encourage them to watch comedies. Lying on your side in the fetal position is a very good way to help with diaphragmatic breathing. It is easy to practice at night before you go to sleep. And it is also something they could do if they feel an asthma attack coming on to try to control their breathing. For little kids, getting them to do a lot of these things is difficult. You can always come up with games for them to play. Perhaps putting a pencil on a desk and have a game where 2 people are trying to blow it back and forth across the desk at each other, or perhaps using a tennis ball on the desk. Anything that makes them exhale longer is what you're trying to come up with. Controlling their environment is super important. Many asthmatics have pets, even though they're allergic to them. I once had a patient tell me that she was allergic to cats, even though she had one and even slept with it. I asked her what did she like more, breathing or her cat, and of course, she picked the cat. Regardless, pets should not be allowed into their bedrooms. You should remove all plush toys and books, as they have a tendency to collect dust. Now, you can't be super mean to a kid and take their favorite teddy bear away from them. So let them have a few, but you can freeze it or wash it in hot water, and that will get rid of the dust mites. You can remove the carpet from the bedroom, leaving just hardwood floors, or perhaps just putting in tile. Schools and daycares need to know a child has asthma, and they should have a copy of the asthma action plan. They should have extra medications available in case they're needed, and you should find out if they go on field trips, and if they do, will they take the medications with them. My wife works at a school and told me that the kids, of course, go out for recess, and some of them have asthma, but their asthma medications are at the nurse's office. If the child has a severe asthma attack outside, they're going to have to go inside to get the rescue inhalers. This doesn't sound like a very wise plan to me. The child can play sports, but they should pre-medicate 15 to 20 minutes before playing the sport, not wait until they start having breathing difficulties. They also need to warm up before and after playing the sport. These are some suggestions you can make to help the patient avoid having an asthma attack. Learn relaxation techniques, whether standing or sitting. They can relax their shoulders, drop their head, taking a big deep breath in and exhale slowly. Little children may not want to do this, so you can make up games for them such as the elephant walk, Have them pretend to be an elephant as they walk really slowly. Then they can pretend their arms are the trunk and swing them around. This might help them relax, do breathing exercises, and kind of makes it fun for them all at the same time. You're going to have to experiment and see what works for you. Keep the nasal passages clear. Stuffy noses make it harder to breathe, and it might be full of allergens. Exercise daily for at least 10 to 15 minutes, walking, running, playing soccer, biking, whatever works for you. The most important thing is to do it consistently. Take a shower daily, maybe at night. This will remove the allergens that have landed on your body throughout the day. When you go to sleep and all those allergens that have landed in your hair throughout the day are now drifting around your head as you sleep, no wonder you can't breathe at night. Adding Epsom salt or essential oils to bath water might add to the relaxation effect. The Buteyko method came out of Serbia and involves pinching the nose, then breathing in and holding your breath as long as possible. You then slowly release the nose and breathe out through the nose very slowly. Seems to me this would just increase your CO2, but apparently for some asthmatics this has helped them. I mentioned exercise earlier, but to be more specific about it, at the start of the exercise, you want to breathe in quickly and then breathe out long and slowly and carefully. You want to repeat that at the end of the exercise. They should carefully monitor their breathing during the exercise and be sure to warm up prior to the exercising and cool down at the conclusion. And of course, when finished, be sure to relax and rest. Having a healthy immune system is very important. Asthma attacks are often triggered because of respiratory illnesses. If your immune system is able to fight off the bacteria or the virus that's causing your respiratory illness, your asthma will improve. Also, as you know, the immune system plays a part in the inflammation that goes along with asthma. If the immune system is healthier, perhaps it won't overreact as much. Now, when I first read this, I thought it was crazy, but I looked into it and it's a thing. The thymus is a gland in your chest that creates your T cells for your immune system. That's why they're called T cells. Beating on the thymus or pounding on your chest, according to the theory, will stimulate the thymus and help your immune system. And it also, of course, might help break up phlegm in the lungs. So I guess pretending that you're Tarzan might help you. You should always encourage your patients to improve their diets. You could even get dietary involved if that's available to you. Many people, especially the poor, have poor diets. Their diets are often lacking in basic vitamins and minerals that are required by the human body, so supplements might help them. Some people use what is known as a mono diet, where they drink the juice of one fruit or one vegetable only for 3 days. It's kind of a cleanse for your system. Now, I've never done a cleanse diet before, but I know several people who have, and they seem to swear by it. You can drink the juice of fruits, vegetables, or herbs. They are super rich in vitamins, natural sugars, minerals, enzymes, trace elements, and are really good for you. Although this comes with one caution. I once read that people that drink their fruit rather than eating it are 3 times as likely to develop diabetes because fruit juices are highly concentrated in sugar. So keep that in mind. Food allergies and additives are very common triggers for asthmatics. Foods are a little easier to pin down than the additives, but one of the common food allergies is from peanuts. As a side note, peanuts are not nuts, but are actually a legume. Tree nuts, dairy products, fish, shellfish are also common allergy-causing foods. There are many food additives that can trigger asthma attacks, such as sodium metabisulfate. Now, that is used to prevent bacteria growing in foods. You can also preserve color of canned and prepared foods, and it causes the retention of vitamin C. It is also used to extend the shelf life of meat products such as fresh sausages and burgers. Tartrazine is found in all kinds of things like syrup toppings, sauces, soft drinks, snack foods, all kinds of stuff. It is also used to color medicines like yellow, green, and orange. Many artificial colors can trigger asthma attacks. There is a long list of additives that are potential suspects. Sunset yellow FCF, brilliant blue, calcium benzoate, sodium sulfite, potassium metabisulfite, monosodium glutamate, known as MSG, just to name a few. Herbal medicine has been around for a long time, and there are records indicating that the Chinese used herbal medicines to treat asthma more than 5,000 years ago, so it's been around for a while. Garlic possesses antiviral, antibacterial, and antihistamine properties. Natural garlic is best, but if the odor bothers you, garlic capsules are available at pharmacies. Echinacea is known as an immune system booster. Ginkgo biloba is usually used for its anti-aging properties, but it does help overcome fatigue, depression, and anxiety. The Chinese have been using ginseng for over 5,000 years because it has a strong influence on the immune system that is similar to steroids. Licorice was used by the American Indians as a tea and a cough remedy, and is a soothing elixir for the throat, so it is used today for chest complaints including asthma. It also has anti-inflammatory properties. Now, this is not the candy licorice, as that is something completely different. Eucalyptus oil is often used in preparations for treatment of asthma. I am most familiar with aloe vera for its use on sunburns, but aloe vera steam from the gel can be used to soothe bronchial congestion, and aloe vera juice effectively eases cough. That is not an all-encompassing list, by the way. There are plenty more. I just wanted to give you guys a sample of what is available. Homopathy is derived from the Greek word homeos, meaning like, and pathos, meaning suffering. So it is all based loosely on the like being treated with like. They try to treat you by giving you tiny amounts of substances that would produce these same symptoms. It is believed to work because the remedies stimulate the immune system to fight the particular symptom patterns. Groups of symptoms that they could treat would be mental, emotional, fear, cravings, and aversions. Aromatherapy is an ancient practice, although the word was coined by the French in the 20th century. Egyptian priests back in Cleopatra's day used aromatic oils to help heal the sick. Essential oils are extracted from flowers, trees, bushes, roots, seeds, herbs, things like that, and they contain vitamins, hormones, cell-regenerating agents, and are believed to work in two ways, directly on the body and on the emotions. As I am sure you are well aware, they are enjoying a renewed popularity. I have to admit that I am not very happy when I walk into an asthmatic's room and the family has the air filled with the scent of essential oils. I can barely breathe and I wonder how the patient can. However, maybe it works. Aromatherapy has been divided into three different areas: clinical, holistic, and anesthetic. For the clinical area, essential oils are prescribed along with herbal preparations to treat diseases. Some essential oils are known to have antifungal and antibacterial properties. This would obviously help an asthmatic. The soothing smells can be used to treat your mind, body, and spirit, and some of the essential oils are used by beauty therapists to treat skin problems. Calamine calms inflammation and soothes allergies. Marjoram calms the emotions. Juniper releases acute anxiety and stress. Tea tree oil strengthens the immune system. Eucalyptus is good at relieving nasal congestion and opening up the airways. I have been in parks in California where they have eucalyptus trees, and I can definitely say just the smell of the eucalyptus trees will do that for you. I call this section All Hands on Deck because it involves touching the patient with your hands. Chiropractic is not a healing approach that aims to be a cure-all, but it tries to rectify muscular and skeletal disorders to energize the nervous system and activate the body to heal itself. Osteopathy is the theory that many illnesses are the result of bones, joints, muscles, and ligaments being out of alignment. They believe by fixing these issues, you can reinvigorate the blood and nerve supplies for the body and therefore improve the patient's general health. Of course, massage is something you do naturally. If you injure your shoulder or something, you're going to rub it and it makes it feel better. So massage obviously is good for relaxation and mobilization of secretions. There is something called a Bowen technique where muscles around the rib cage, under your sternum, under your diaphragm, around your spine and base of the neck and back are the focus. And what they do is they put pressure, which is light but firm, and they just use 2 to 4 fingers and gently roll it from side to side, and that apparently triggers the muscles to relax. It rebalances your energy levels and corrects any skeletal irregularities. Some asthmatics swear by it. Reflexology is an ancient Chinese and Indian pressure therapy that primarily focuses on the soles of the feet. By massaging certain zones of your feet, it can stimulate your body to heal itself. Unfortunately, my feet are way too sensitive, and I would never be able to stand someone doing that to me. Acupressure is the application of pressure to one or more acupressure points on the body. Activating pressure points on the cheek, nose, and various parts of the chest, back, and shoulders can relieve asthma and act as a preventative measure. This method is popular with the Chinese. Magnetic therapy involves taping magnets to acupressure points. Some arthritis sufferers swear by it, and apparently it can help with asthma. Magnets can be put into support braces like for the back, knees, ankles, wrists, elbows. And there's also magnetic jewelry. While there's no known adverse effects, I really wouldn't use this if I had a pacemaker or were pregnant. Yoga, of course, is the art of relaxation and diaphragmatic control for breathing. Perhaps this is one of the best things for an asthmatic. Yoga is all about mental well-being through physical movement and breathing patterns, so it would be something you might suggest for your asthmatics that they look into. Tai Chi is from China. It's all about body awareness through a routine of relaxation, controlled breathing, flexibility, and mobility. This could be useful to eliminate stress or control it, and also to teach diaphragmatic breathing. Hydrotherapy can be submerging someone in a bath of ice-cold water, perhaps natural mineral springs or spas. Water has a lot of natural healing abilities. Breathing in higher humidified air might help. Many asthmatics find relief by going into the bathroom and running a hot shower. A relaxed body responds to healing, a tense body does not. Many people feel soothed when touched. Simply placing your hand on their shoulder or holding a patient's hand may calm them. But I'm not sure that I would hug my patients, although I have seen it done. Transcutaneous nerve stimulation is a small battery-powered machine that sends extremely weak electrical impulses through the skin via pads. This is not a new concept. A Roman doctor apparently placed a patient's swollen foot on a live electric eel to treat gout. Once it became possible to store electricity, doctors used it to treat various aches and pains by running an electrical current through people's bodies. It might help asthmatics by relieving muscular tension, improving blood supply, and lessening fatigue. Ions are negatively and positively charged particles, and the air is full of these. We come in contact with them all the time. Having a negative ion-rich environment seems to help headaches, depression, and skin allergies. Some studies have shown that negative ions can also speed the healing process for wounds, sores, and injuries. There are countless books on the benefits of positive thinking, and some people think all things are possible with positive thoughts and attitudes. The theory is unhealthy thoughts breed unhealthy bodies, and of course the opposite is also true. I believe that positive thinking is very good for us. I think a positive attitude is good for our patients, and that is one of the reasons I'm glad visitors are back in the hospital. Hypnosis creates an altered trance-like state of mind or consciousness. Hypnotherapy can be used to heal physical illnesses, reduce pain, and induce relaxation. Meditation is a self-help way to ease stress, which of course could prevent asthma. It involves gentle breathing, and that of course can reduce oxygen consumption. The power of faith and prayer cannot be underestimated. Many people believe in a higher power, some do not, but don't discount a patient's spiritual beliefs. Painting, drawing, coloring, all of these are relaxing hobbies and should be encouraged. Biofeedback is a method that can be used to control some of your bodily functions that you might not think you can because they are not under conscious control, but you can learn to influence them. Music therapy is something we use at my hospital. We have a harpist that goes around playing music to the patients in the ICU. It has a very soothing effect on everybody. With crystal therapy, naturally occurring crystals are placed on the patient's body parts which need help. Maybe a piece of quartz on a patient's chest somehow relieves asthma. I'm not sure, but some people believe it. Although if a sugar pill works, why not this? The patients are going to have to learn some coping mechanisms, learn to cope with stress, how to avoid allergens, how to avoid pollution. I have seen many asthmatics that come to the hospital that also smoke. You need to refer them to a smoking cessation program. They need to be aware of the weather and stay indoors when it's not asthma safe for them to go outside. Some patients' asthma is triggered by cold weather. Others are triggered by hot weather. I once had a patient who told me when he was young, cold air bothered him, but now that he's older, warm air does. So it can change throughout their life. Be sure to encourage your patients to have a written asthma diary. Most patients are poor historians. They forget about things. They leave something important off their record, and that's why a written record is better. It will also be easier for them to determine what triggers their asthma, and if it's written down, they can refer back to it to see if certain times of the year their asthma is worse. This could indicate seasonal allergies, perhaps foods they have eaten which triggered an attack, types of animals they have been around, etc. Of course, they should be taught how to use a peak flow meter and how to take readings twice daily. They should also be given a written asthma action plan before discharge. Let's summarize and review what we've talked about. We quickly reviewed standard asthma treatments. We covered alternative medications, many of which are under investigation as steroid-sparing agents. Then we covered standard and alternative ways to diagnose asthma, including strange things like looking at their tongue and palm. Then we covered breathing exercises such as pursed lip breathing, swimming, singing, and playing wind and brass instruments. We covered environmental controls, including keeping animals out of their bedrooms and removing carpet. We reviewed breathing types and diaphragmatic breathing. We also covered attack avoidance, exercising, boosting their immune system, and food allergies. Alternative medicines we discussed included herbal medicine, homopathy, aromatherapy, chiropractic, massage, acupressure, and magnetics. We also covered a few miscellaneous therapies like yoga, tai chi, and transcutaneous nerve stimulation. We discussed mind control, art, biofeedback, and ended with some coping strategies. Here are the key takeaways from this class. Don't discount everything the patient is doing on their own just because it isn't a drug. You should try to incorporate some of that stuff into their asthma plan. Just because you don't believe it doesn't work doesn't mean that it actually doesn't work. Some of the therapies we discussed have been around for thousands of years. At my hospital, many patients can't afford their medications. These are very expensive. An inhaler can cost $300. Finding alternative ways for them to manage their asthma may save their lives. This brings us to everyone's favorite slide, the end. Following are the references used to make this course, and be sure to fill out your evaluation. Once that is completed, your certificate can be printed by using the menu Account Courses, which is located at the top of the website.